HIV/AIDS affects millions of women worldwide. According to the World Health Organization, women account for more than half of all people living with HIV globally. In sub-Saharan Africa, women represent nearly 60% of people living with HIV. This region has the highest prevalence of HIV/AIDS in the world. In the United States, women account for about 19% of new HIV diagnoses each year. African American women are particularly affected, representing 59% of new HIV infections among women in the US globally. Young women aged 15 to 24 are twice as likely to be infected with HIV compared to young men. Despite these alarming statistics, there has been progress due to increased awareness and better access to testing and treatment. However, more work is needed to ensure all women have access to care and support. Women face unique challenges related to this disease. Early detection can significantly improve outcomes and quality of life. This video aims to educate about the early signs of HIV/AIDS in women and the importance of regular medical checkups. Women often exhibit different symptoms than men, leading to delays in diagnosis. Recognizing these differences is crucial. Early intervention can prevent the progression to AIDS. We will explore common and specific symptoms of HIV/AIDS in women. Understanding the symptoms and seeking timely medical advice can save lives. Let's begin with a brief overview of HIV/AIDS. HIV stands for human immunodeficiency virus, which attacks the immune system. If untreated, HIV reduces T cells, making the body prone to infections and certain cancers. This can lead to AIDS, the final stage of HIV infection characterized by a severely weakened immune system. Opportunistic infections like tuberculosis and pneumonia become more frequent and severe. HIV is transmitted through infected bodily fluids, including blood, semen, vaginal fluids, and breast milk. Common transmission methods include unprotected sexual contact, sharing needles, and from mother to child during childbirth or breastfeeding. HIV is not spread through casual contact like hugging or sharing dishes. Understanding HIV/AIDS is the first step towards recognizing its symptoms. Awareness of these signs can lead to early diagnosis and better management. Now let's look at the common early signs of HIV/AIDS in women. The early signs of HIV/AIDS can often be mistaken for other illnesses. One of the first signs is flu-like symptoms, including fever, chills, and night sweats. These symptoms usually appear within 2 to 4 weeks after exposure. Persistent headaches are another common early symptom. Women might also experience swollen glands in the neck, armpits, and groin. Another early sign is severe fatigue, often not relieved by rest. Fatigue can have many causes, but when combined with other symptoms, it can indicate HIV. Finally, muscle and joint pain similar to flu aches can persist for an extended period. Early recognition of these signs can prompt individuals to seek medical advice sooner. Recognizing these early symptoms is critical. However, there are also specific symptoms more prevalent in women. Women with HIV/AIDS might experience specific symptoms. Recurrent yeast infections are one such symptom. Frequent or hard-to-treat yeast infections can indicate a weakened immune system. Unusual menstrual cycles, including irregular periods or missed periods, are another symptom. These changes can be due to the immune system's impact on the reproductive system. Pelvic inflammatory disease, PID, is more prevalent in women with HIV. PID can cause chronic pelvic pain, fever, and unusual vaginal discharge. Women with HIV are at higher risk for PID, which can be more severe and harder to treat. Other gynecological issues like genital ulcers or warts can be more frequent and severe. Monitoring reproductive health closely and reporting unusual symptoms to healthcare providers is vital. Recognizing these specific symptoms can lead to earlier diagnosis and treatment. Early detection of HIV is crucial for several reasons. It allows for timely treatment with antiretroviral therapy, RT, which can manage the virus and improve immune function. ART can also reduce the risk of transmitting the virus to others. Early detection can prevent the progression to AIDS. With proper treatment, many people with HIV can live long, healthy lives. Regular medical checkups play a crucial role in early detection. Women should undergo routine screenings for HIV, especially if they are at higher risk. Early detection can improve the quality of life. Knowing one's HIV status allows for informed health decisions. Consider the story of Adriana, a young woman from Brazil. Adriana was diagnosed with HIV at 22 after experiencing recurrent yeast infections and severe fatigue. Initially, she did not suspect HIV, thinking these symptoms were related to stress. After a routine HIV test, she was diagnosed and started on antiretroviral therapy. Early detection allowed Maria to manage her condition effectively. Another example is Nandifa, a 35-year-old woman from South Africa. Nandifa experienced irregular menstrual cycles and frequent headaches. She ignored these symptoms, thinking they were due to her busy lifestyle. When she finally saw a doctor, she was diagnosed with HIV. Starting treatment improved her health significantly. Nandifa now advocates for regular HIV testing and awareness in her community. These real-life examples show the diverse experiences of women living with HIV/AIDS. Early detection and treatment can make a significant difference in managing the disease. HIV/AIDS is a significant health issue that requires ongoing attention and action. Women face unique challenges related to this disease. Early detection and regular medical checkups are crucial in managing HIV and preventing its progression to AIDS. Awareness of the early signs can lead to timely diagnosis and treatment. Regular screenings, especially for high-risk groups, are essential in the fight against HIV/AIDS. Statistics and real-life examples underscore the importance of continued efforts to address HIV/AIDS among women. While progress has been made, there is still much work to be done. Education, access to healthcare, and community support are key components in reducing the impact of HIV/AIDS on women globally. By recognizing the early signs of HIV/AIDS and seeking timely medical advice, women can take control of their health. Let's continue to raise awareness and promote regular checkups to ensure a healthier future for all women.